It's great to have you. So I want to start by acknowledging the progress that the country has made in the pandemic. Cases are among the lowest they've been since the start of the pandemic. Vaccinations are rising. But is there a concern about a resurgence in the latter part of the year as the weather gets colder? And how much of this hinges upon what our understanding is of how long these vaccines are effective?
Well, I don't think we should be that concerned right now about how long they're effective. I think they will be effective long enough that we will get to the point where we are not going to be necessarily worrying about a surge. Let me explain what I mean. The positive wild card in all of this that we didn't have during the previous three surges that our country has experienced, the most profound of which was one at the late fall and early winter of the 2020-2021, where we had cases as high as 300,000 per day and deaths up to almost 4,000 per day. That was at a point when virtually no one in the country was vaccinated. If we get to the president's goal, which I believe we will attain, of getting 70% of the people getting at least one dose, adults that is, by July 4th, there will be enough protection in the community that I really don't foresee that there being the risk of a surge, provided we continue to get people vaccinated at the rate we have now. Of course, there are several things that are uncertain when you're dealing with a pandemic. One thing that is quite certain is that when you have a vaccine or a group of vaccines that are as highly effective in the real world, and those data are very clear, highly effective as these vaccines are, and you get a substantial proportion of the population vaccinated, the chances of there being a surge are extraordinarily low. I mean, quite low. You don't want to declare victory prematurely, and it's for that reason why we're continuing to put the push on of getting as many people vaccinated as we possibly can.